To break down the numbers with more impressive verbiage is the guy who makes sense of so many things for us in terms of healthcare, a Newsmax Deputy Health Editor, Nick Tate. Nick, it's good to have you back in studio today.
Good to be here, man.
And let's begin, not with numbers so much, but again with the aforementioned verbiage. A duel between two circuit courts of appeal dealing with Obamacare. Encapsulate those two different rulings and what you think is going to happen next.
Well, the appeals court and the D.C. district on Tuesday ruled that the subsidies that the federal government provides to defray these rising costs of health insurance are in fact illegal. And so about $36 billion that would go to those 36 states where the federal government is running those exchanges could go away if that decision is upheld. Interestingly, within hours of that decision, the Virginia Court of Appeals ruled that in fact the subsidies are just fine and they should continue. So what I think we're setting up here, what's being set up here, is a decision for the Supreme Court to issue. And in the next year, if those subsidies go away, it could result in increases of premiums in those 36 states that by some estimates range up to about 76%. So an enormous amount of money that we're already spending a lot for healthcare. In this country we spend twice as much as virtually any other country on the planet. But if those subsidies go away, which were to defray the cost of health care, we're going to see incredible hardship.
So, again, if the Supreme Court is to go along with the D.C. Circuit, and we know there may be other steps in between, they may issue en banc decisions, get
Correct.
all 11 judges on each circuit together, but still, if that ruling comes out finally, that means exponentially higher costs.
Absolutely. The subsidies are, I would describe them as kind of, that stray thread on a sweater that you tug it and the whole garment becomes unraveled. And for millions of Americans, it would be an extraordinary new cost.
There are so many different acronyms around, so many different organizations, one being the NCPA. Now, we can begin with the acronym and then take a look at their new report on health care. Is this something that offers independent, sober analysis of what's happening?
Projections have really been all over the map, and almost every group that has projected healthcare spending costs over the next 10 years has had some political or some leaning in one direction or another. The place that I would look is where we're seeing the states already beginning to get the insurance numbers, the projections for premiums next year. So, for instance, in the state of Ohio, the Department of Insurance has received proposals from insurance companies for those individuals who buy their health insurance on the federal exchange, the Obamacare exchange in Ohio. They're projecting average increases in premiums next year of 13%. Now, that's something like 3 or 4 times the rate of wage growth. And I think that as goes Ohio, so goes much of the country. The larger projections in the other states are that we're going to see at least 10 to 15% increases in premiums next year. So the numbers that I would look at are not coming from the various think tanks and organizations, but the actual states where the insurance commissioners are getting those numbers right now. Now, they're not final. We won't have the final numbers until we get closer to November when the next open enrollment period begins. But the early preliminary numbers suggest we're going to be looking at double-digit increases in most of those 36 states where the federal government runs the exchanges.
This program got off to such an abysmal start. And we talk about a country of 300 million people. And it seemed in retrospect we were hearing, wow, maybe 8 million signed up for this. Do we have a handle yet on actually who is covered under Obamacare and others with their health care insurance intact or at least restored?
Well, we do know that there are, as you say, the 8 million who signed up through these new exchanges. But beyond that, the expectation is that because the law requires everyone to have insurance, the individual mandate, you must have it or you will pay a fine, somewhere between 90 and 95% of Americans over the next 10 years will have insurance. But the question is, what are we going to pay for it? As I suggested, there's nothing in the law that holds down the cost of health care, and as the health care costs continue to rise, exponentially in some cases, there's also nothing in the law that prevents insurers from passing on the costs of those rising health care costs to individuals, to businesses, to families in terms of premiums. So, the goal of the Affordable Care Act was to make sure that as many people as possible could be insured through Medicare, Medicaid, buying it on their own, or through their employment. But the second question, the second shoe to fall is, what are we getting for it? What are we paying for it? And is it something that is going to continue to be a huge hardship for many families that are struggling to just put food on the table and make ends meet.
Nick, in that response, to paraphrase, you said the law is silent on a couple of things involving this economic interchange between consumers or patients and health insurers. It can also be said, and it's back to verbiage, pardon me, verbiage as garbage. You had a 3,000-page bill, but a lot of that is boilerplate language to allow the regulators at HHS to step in with regulation. Now, you talked about 10 years for getting people signed up. How long is it going to take for people to understand the new fine print from the regulators at HHS?
Well, they haven't written many of the laws. I mean, something like 41 of the main provisions that were set to take effect since 2010 have either been delayed or they're behind schedule. So we don't really know even the simplest thing, like how are they going to enforce the individual mandate? Are they going to hold to the deadlines on the employer mandate that requires employers to provide health benefits or pay a fine? So it's enormously complex. And this is an area where I think a lot of Americans are confused anyway. Health insurance is not something that's very, very simple. So confusion, extra cost, questions about what you're getting for what you pay. There's a huge consumer story here. And my recommendation, I mean, part of the reason that we do what we do here is to let people know, here's what's coming your way, here's how to make the smartest decisions you can. That's more important now than perhaps ever before with health insurance. You need to be a savvy consumer.
So whether it's Wall Street or Main Street or your street, uncertainty in the marketplace is not a good thing. Nick Tate, as always, we appreciate your time and your insights.
My pleasure.
And of course, to find out more about this, you can go to healthradarnow.com to get a special offer on the Obamacare Survival Guide. You see it right there. Nick Tate had a very active hand in putting that together. For that, we congratulate him, and we tell you that's a good source dealing with these uncertain times. Your thoughts on Obamacare? Is it just what the doctor ordered? Tweet us your comments at Newsmax TV, #America's Forum.